Hey guys, welcome. I'm going to be talking about syncope today. So let's talk about it. All right. So syncope is basically going to be a transient loss of consciousness due to decrease in blood flow to the brain. And the mnemonic that I like to use is right here. It's called VOSCO, VOSCCO, VOSCO. So let's look at it. I'm going to cover the half part so that we don't feel overwhelmed. So V is going to be for vasovagal, O is going to be orthostatic, S is going to be situational. The other C is going to be structural or arrhythmia-associated cardiogenic issues, and O is going to be for others. So this is going to be the mnemonic VOSCO for syncope. And of course, there are other causes of syncope, but these are the most common ones that you'll find in step 1, 2, and 3. All right, so let's dive into each one of them. So for vasovagal syncope, we know that it's because when a patient has an increase in parasympathetic outflow. So we're looking for situations where a patient has some sort of emotional stress, pain, or fear, which causes a parasympathetic outburst, right? And the signs would be bradycardia and hypotension. Usually, in order to diagnose this, it's clinically diagnosed, and you can do something called a tilt table test, but that's usually for certain circumstances. But most of the time, if a patient has an emotional stress and then they had an episode of syncope, clinical diagnosis is enough. For treatment for vasovagal syncope, it's usually going to be reassurance. Okay, so that's vasovagal syncope. Let's look at orthostatic syncope. Orthostatic syncope is when a patient has decrease in blood pressure due to gravity. So think about the causes being associated with volume. So low volume, hypovolemia, or it can be neurogenic like diabetes or Parkinson's. And usually, the patient presents with dizziness upon standing. So in order to figure out whether it's hypovolemic or diabetes or Parkinson's, you have to take a thorough history and figure out, okay, or did the patient recently had volume loss, right? Were they having diarrhea, bleeding, or do they have a history of diabetes or Parkinson's that's not well controlled? So that's how you figure out whether it's due to volume issues or neurogenic issues. And the treatment for hypovolemia would be fluids, obviously, and the treatment for diabetes and Parkinson's would be trying to control the disease. And if you're unable to control the disease, then you can give them fludrocortisone or midodrine. Fludrocortisone is going to be a mineralocorticoid, and it is going to be associated with sodium retention, right? And fluid, so it's going to increase your blood pressure. It's a mineralocorticoid agonist. And you have your midodrine, which is supposed to be a vasoconstrictor, so it is going to increase the blood pressure by vasoconstricting blood vessels. The next one is going to be situational. So situational syncope is a type of vasovagal syncope, but it is present in certain situations. So think about when a person is coughing or sneezing, or they have hypersensitive carotid sinus stimulation. For example, the patient is tying their tie and suddenly they have loss of consciousness, right? So that's hypersensitive carotid sinus stimulation associated syncope. And the treatment is usually going to be reassurance. Next up is going to be cardiogenic. So cardiogenic is divided into either structural or arrhythmia. If it's structural cardiogenic, think about causes such as aortic stenosis or hypertrophic cardiomyopathy. And the patient usually has syncope on exertion. Diagnosis is usually going to be a transthoracic echocardiogram, and that's going to show the structural issues of the heart, whether there is an aortic stenosis or whether there is hypertrophic cardiomyopathy. The other cardiogenic cause of syncope is arrhythmia. So think about bradycardia or ventricular arrhythmia that's causing a person to have syncope. So they can present with syncope without a prodrome, or they can present with syncope with chest pain or palpitations. And in order to diagnose this, we're going to do an EKG and we're going to do a cardiac monitoring in order to catch the arrhythmias. The other causes of syncope would be subarachnoid hemorrhage or pulmonary embolism. So of course, there are other causes, but these are the most common ones that I've seen so far in the vignettes. All right. So let's review it real quick before we do our review questions. So if a patient has a parasympathetic outflow that's in parasympathetic outburst, right? We're thinking about vasovagal syncope, right? So think about bradycardia, hypotension. Parasympathetic is going to decrease everything. So heart rate's down, blood pressure's down, right? And treatment is usually going to be reassurance. If a patient has a history of Parkinson's that's not well controlled, and now they have a history of fall, right? And now they have an episode of fall, then think about orthostatic hypotension because of the Parkinson's. So it's a neurogenic issue. Then think about other causes, such as when a patient has syncope while they were exercising. That's usually because of hypertrophic cardiomyopathy or aortic stenosis, right? And to diagnose that, what would you do? You would do a transthoracic echocardiogram. Okay. And bradycardia and ventricular arrhythmias, if a patient has some sort of arrhythmia, history of arrhythmia, right? The most likely diagnosis tool that you can use would be a EKG and cardiac monitoring to catch those arrhythmia if the patient doesn't already know that they have an arrhythmia. All right, so let's look at the review questions now. So if a patient had a syncopal episode after a recent breakup, what kind of syncope are we looking at? A syncopal episode after a recent breakup, that's increase in your parasympathetic outflow, right? So this is going to be your vasovagal syncope. A patient had chest pain and then a loss of consciousness. This is going to be your cardiogenic structural syncope. A patient had an episode of syncope, and upon further investigation, he was hiking with his friends a week ago. What kind of syncope is this? So he was hiking with his friends a week ago. Think about Lyme disease causing heart block, and that is associated with arrhythmia. So this is going to be a cardiogenic arrhythmia caused syncope. A patient was exercising and he suddenly felt dizzy. This is cardiogenic, structural, right? A patient complains of brief loss of consciousness every morning when getting ready for work. This is situational, right? So, and think about when he's getting ready for work, he's probably putting a tie on, and that's causing the hypersensitive carotid sinus stimulation. All right, so that's all for syncope. And if you want to take a picture here, go. Hopefully it was helpful. See you in the next one.